Part 3. Systems Unpacked. Systems and Service Lines. Chapter 1. Understanding Children's Behavioral Health Service Lines. A wide range of treatments and services are available for children and adolescents. These services exist on a continuum of care, ranging from the most intensive to the least restrictive settings. For example, some individuals may only need to meet with a therapist once a week, while others may require 24-hour supervision in a hospital setting. The goal is to provide the least restrictive setting that appropriately meets the individual's needs. As a child's needs change, their services may also change. Factors such as diagnosis, response to treatment, and social environment determine the level of care an individual receives. This chapter explores the behavioral health services available along the continuum of care. Outpatient services. Outpatient services are the least restrictive setting for receiving treatment. These community-based services provide evaluation, diagnosis, treatment planning, medication management, and therapy. A variety of mental health professionals, including counselors, clinical social workers, psychologists, and psychiatrists, provide these services. Outpatient therapy may be conducted individually or in groups, typically ranging from weekly to monthly sessions. An intermediate form of outpatient therapy is intensive outpatient therapy, IP. Unlike traditional outpatient therapy, IP involves meeting with a mental health professional 2 to 5 times per week. The most intensive form of outpatient therapy is a partial hospitalization program, PHP, which is still non-residential. Individuals in PHP attend treatment for 4 to 6 hours a day, but return home at night. For children and adolescents, PHP often includes on-site schooling alongside therapy and group sessions. PHP can also serve as a step-down program for individuals transitioning from inpatient hospitalization. In-home services. Beyond outpatient services, several in-home services support children, adolescents, and their families. Case management is an in-home service that includes monitoring, linking, advocating, and providing support within the home environment. The next level of in-home care is Behavioral Health Rehabilitative Services, BHRS, also known as wraparound services. BHRS is individualized for each family to promote stability and improve the child's functioning at home, school, and in the community. A BHRS team includes a behavioral specialist consultant, BSC, who writes treatment plans and supervises the team, a mobile therapist, MT, who provides in-home counseling, and a therapeutic staff support, TSS, who works one-on-one with the child, offering support and redirection. Beyond BHRS, Family-Focused Solutions-Based Services, FSB, provide therapy for children diagnosed with mental illness who are at risk of out-of-home placement. These services are available for the entire family, including siblings, and include 24/7 support. Similarly, family-based mental health, FBMH, services offer comprehensive treatment to keep children in their homes while providing the necessary level of care. FEMH services are available around the clock and may include treatment for the child and family members, case management, and family support services. For adolescents age 16 and older, community treatment teams, CDT, provide intensive, in-home services. CTT teams consist of a psychiatrist, nurse, therapist, case manager, and vocational specialist who work together to help the individual transition to stable community living. Emergency placement services. In emergency situations, a child or adolescent may need immediate removal from the home. While these events cannot always be anticipated, emergency placement is necessary if the child's symptoms are severe enough that the family cannot provide care, or if the child poses an imminent risk of harm to themselves or others. The first step in emergency placement is contacting a crisis network such as Solve, which is available 24/7 and trained to handle emergencies. If out-of-home placement is required, diversion and stabilization units, DS, provide short-term, emergency, or respite care for up to 28 days, diverting children from more restrictive inpatient units. Another emergency placement option is the Western Psychiatric Institute and Clinics, WPIC, Diagnostic and Evaluation Center, DC. Before admission to WPIC, an individual must be evaluated by a physician at the DC. Additionally, hospital emergency departments can assess individuals who pose an immediate risk to themselves or others while awaiting level of care determination. Inpatient services. When a child or adolescent requires long-term care outside the home, inpatient facilities provide the highest level of treatment. Inpatient settings are the most restrictive but offer intensive supervision and therapy for individuals with severe needs. One form of inpatient care is a residential treatment facility, RTF. RTFs provide structured, long-term treatment for individuals who require constant supervision. The typical length of stay ranges from 2 to 6 months, depending on progress. Another form of inpatient care is hospitalization, which is reserved for individuals who present an imminent risk to themselves or others and cannot be managed in a less restrictive setting. The primary goal of inpatient hospitalization is symptom stabilization and preparation for transition to a less restrictive environment. Addiction service lines. Addiction services also follow a continuum of care model, though the process often works in reverse. Many individuals begin in the most restrictive settings, such as detoxification centers, before transitioning to outpatient therapy. Addiction treatment is typically voluntary, unless court-ordered, meaning individuals can leave treatment at any time, unlike some behavioral health services. The first step for individuals currently using substances is detoxification. This process involves medical monitoring and treatment for withdrawal symptoms. Detoxification can occur in hospitals or private community agencies and typically lasts 5 to 7 days. After detoxification, individuals often enter a residential rehab center, which provides intensive treatment through individual and group therapy in a structured setting. Some rehab centers are hospital-based, while others operate independently within the community. The length of stay varies based on progress and facility policies. Following residential rehab, some individuals transition to a partial hospitalization program, PHP, for addiction, similar to behavioral health PHPs. In PHP, individuals spend most of the day in treatment but return home at night. Once an individual and their therapist determine they can maintain sobriety with less support, they move to outpatient therapy, which may be individual or group-based. Many individuals experience both behavioral health disorders and substance use disorders, a condition known as dual diagnosis. Specialized treatment programs exist for dual diagnosis individuals, integrating behavioral health and addiction services. However, dual diagnosis treatment resources are limited, and availability varies by location. It is recommended to inquire about local dual diagnosis programs to explore treatment options.